The ultrasound beam is represented by this red laser light line. To find the spleen, the transducer is used to move the ultrasound beam to the very dorsal left lateral abdomen in an off-sagittal position between the last ribs. The beam follows the leading or cranial edge of the spleen wherever it goes in the abdomen until the tail of the spleen is reached. Then the beam is moved a little caudally or to the patient's left side and follows the caudal or left edge of the spleen cranially to the head. The purpose of this movement is to overlap the ultrasound beam so that the entire spleen is examined. In cats and some small dogs, the entire spleen can be seen in a single transducer pass from head to tail. We will use a 95-pound Great Dane for the spleen. Remember to keep the organ centered on the ultrasound screen to reduce artifact. This is best accomplished by holding the transducer perpendicular to the patient's body and the organ of interest. Adjust depth to fill the ultrasound screen with the organ of interest. If needed, adjust transducer frequency for the current depth. Adjust gain for the best image. And adjust focal points to the bottom of the organ of interest. Remember to keep one finger of the keyboard hand on the freeze button, ready to capture the best image. When you press the freeze button, practice leaving your transducer hand relaxed and in position so that when you unfreeze, you will still have the same image. This will save you time and effort. Having finished the exam of the stomach, feel for the last rib and place the transducer on the dorsal side of the lateral abdomen and cranial to the last rib. The transducer is in an off-sagittal position to look between the ribs. When you see the head of the spleen and the lateral wall of the stomach, slide the transducer cranial until the spleen disappears. Then reverse directions and follow the spleen caudally, wherever it may go in the abdomen. Try to maintain a short axis view of the spleen and try to keep the leading edge, in this case the cranial edge, on the left side of the ultrasound screen. Over the ribs, part of your view is blocked by rib shadows. The animal is tilted toward the camera so that you can see transducer movements. Now we will place him in the standard dorsal recumbency. On this day and at this time, his spleen extends from the left cranial abdomen to the right cranial abdomen. Note the splenic veins crossing the splenic capsule. Constantly adjust transducer position to keep the leading or cranial edge of the spleen to the left side of the ultrasound screen. The spleen tissue begins to taper down or diminish in size as we reach the tail of the spleen. I must slide the transducer caudally now to keep the cranial edge of the spleen on the ultrasound screen. The spleen disappears. Slide the transducer caudally and follow the spleen from its tail back to the head. Now we want to keep the trailing or caudal edge of the spleen to the right side of the ultrasound screen. We are hoping to overlap our previous view of the spleen so we will not miss any lesions. It is common to see intestinal loops dorsal to the spleen. When that happens, take the opportunity to press the freeze button and use Cinematic Loop to select the best image. Press Caliper or Measure. Place one caliper at the interface of the intestinal lumen and the mucous membrane layer. Place the other caliper on the outer surface of the serosal layer. Label the image and save it to the patient record or archive. Unfreeze the ultrasound machine. If you did not move the transducer hand, we can proceed without missing splenic tissue. Continue following the spleen by sliding the transducer back to the patient's left side. Again, we will tilt the animal toward the camera only to help you see transducer movements. We jump ribs and follow the spleen back toward the head of the spleen. In this area, the spleen is folded from here to here. We end the exam at the head of the spleen where we began.